Madison's journey begins as the sun tiptoes into her room, casting a gentle glow on a face marked by the telltale signs of sleepless nights. The persistent hum of an alarm clock serves as a relentless reminder that another night has passed without the solace of rest. As Madison rises from her bed, the weariness in her movements is palpable, setting the stage for a day that unfolds against the backdrop of her sleep-deprived reality. Stepping into the bathroom, Madison confronts her reflection in the mirror, a visual echo of the internal turmoil that haunts her nights. The ritual of splashing water on her face becomes a futile attempt to wash away the fatigue etched on her features. The question looms in the air: why does sleep evade her, and what is the source of this persistent restlessness? Stepping into the bathroom, Madison confronts her reflection in the mirror, a visual echo of the internal turmoil that haunts her nights. The ritual of splashing water on her face becomes a futile attempt to wash away the fatigue etched on her features. The question looms in the air: why does sleep evade her, and what is the source of this persistent restlessness? The journey continues into the heart of the home, the kitchen. Here, the aroma of brewing coffee mingles with Madison's thoughts, creating a space for introspection. With a cup in hand, Madison leans against the counter, staring out into the dawnlit world beyond her window. The profound silence of the morning serves as a canvas for her contemplation, as she grapples with the origins of her sleepless nights. As she slips on her coat, she decides to embark on a mission to see if the talented and smart medical professionals at her local pharmacy could give her some advice on her situation. While she feels as though maybe she could just pop a melly before bed, she knows that she needs something that will provide a higher relief to her. Madison confusingly misses her way around the car. Probably the lack of concentration will do that to a person. Madison then gets into the 2011 Toyota Corolla and zips around to her local amazing, helpful, lovely pharmacy, Walgreens. Walking into the establishment, she is taken back as one person reaches out to her and begins to ask her about herself. Madison was taken back because it had been a while since someone had reached out to make sure she was all right. She explains that she is looking for something to help with her anxiety and sleep problems, but nothing seems to be working. She's tried drinking tea before bed, reducing the amount of blue light, and even reading 20 pages of her book every night. But alas, nothing has come to work on her frustrating REM cycle. Reese, a certified medical professional, discusses his long life filled with lots of medical school and his research that actually goes into what she seems to be struggling with. Madison, a more data-driven individual, expressed her interest in obtaining additional statistical analysis to thoroughly understand and embrace the information being presented to her. Despite some initial skepticism stemming from the other person's youthful and goofy demeanor, Madison decided to remain open-minded and allowed the conversation to unfold naturally. Recognizing the importance of a more in-depth exploration through statistical data, Madison conveyed her desire for a robust analysis to enhance her confidence in the information being discussed. This exchange reflects Madison's analytical mindset and her willingness to engage in a thoughtful discussion, even when faced with initial reservations. Reese pulls out an article of data analysis and begins to discuss the findings on this particular drug, Ambitril. Madison thought, "Wow, I've never heard of this before." Reese going on to discuss, first, multiple regression was used to assess the significance of numerous factors or variables that might influence drug efficacy, response, or outcomes. Out of all the variables, mean corpuscular hemoglobin concentration, MCH, amount of magnesium, globulin, and whether the patient has a sulfa allergy were all found to be significant. The significance level was set to 0.05, which means any p-value that falls below this would be considered not significant. Something found to be surprising was the effect that having a sulfa allergy had on the patient. When researching prior, Ambitril was maybe a drug that did not contain the compound sulfa. However, the data shows this to be a significant factor on patient relief. Reese pauses to realize I had started looking at the seasonal Christmas items on the impulse stands when he snaps me back into it. He continues, after the best subsets, a regression was run using the predictors from the best subsets, shown in Figure 3. It was determined that all measures were considered to be significant. It appeared that all the predictors used slightly increased in percent on their effect on percent relief in the patient. This model also accounted for 100% of the variation in the data, which also occurred for the other models. After the best subsets multiple regression, an interaction was added to determine if there was a significant interaction in the study. The results of this regression are shown in Figure 4. It was a regression of sulfa allergy and magnesium because magnesium levels could potentially influence the severity of allergic reactions in individuals with a sulfa allergy. Magnesium has been studied for its anti-inflammatory properties, and variations in magnesium levels might impact the immune response. The results showed that there is a very significant relationship between magnesium and the patient having the sulfa allergy. Reese pulls out some graphs and explains that these graphs show that this data show a normal distribution and that there were not too many outliers, which allows us to assume that the data is reliable. Madison asks, why Ambitril though? What does this data even mean for me? The clinical relevance of the findings is essential. If the variables in the regression table have a meaningful impact on the observed relief, it could support the use of a sedative drug for managing symptoms associated with depression or neuropathic pain. The regression analysis can provide information about the predictive power of the model. If the model can reliably predict the percent relief based on the included variables, it suggests that the sedative drug may be effective in providing relief to patients. The regression table helps in understanding the factors that influence the observed relief. For instance, if sulfa allergy is a significant predictor, it might be important for healthcare providers to consider a patient's allergy status when prescribing the sedative drug. Reese explains that he hopes this data could provide any helpful insight I needed into possibly considering using this drug and to really think about all the possible positive outcomes I could get from getting more improved quality of sleep and life. Reese reaches from under the counter and hands Madison a small bottle that reads Ambitril. Madison snatches the bottle and goes, "Wow, this looks amazing. I never knew a drug bottle could look so beautiful." After that chat, Madison happily exits the establishment with a little dancey dance out the door, and heads home to ponder her next steps. She sits down in her chair and thinks for a moment on whether it would be worth it to take. Eventually she caves and pops one in her mouth. 5 minutes later. Madison then takes the time to call Reese to thank him for his magic drug.
I felt lots of relief, so your statistics sounded like it worked, so yeah, super happy with the results, and I will definitely recommend this drug to people who may be needing help in that area. Thanks.
And with Ambitril comes side effects, one of those being dry mouth. And constipation. Oh, it's been 3 days. We better get going. Do it.
Non-stop hiccups. And sleep eating. Wait, no. Let me do it again. It's double E.
Go. Other side effects may include slow or difficult speech, dizziness or faintness, weakness or numbness of the arm or leg, crushing chest pain, rapid pounding or irregular heartbeat, severe skin rash or hives, swelling of the face and tongue, yellowing of the skin or eyes, jaw, neck, and back muscle spasms, uncomfortable shaking of a part of the body, fainting, unusual bleeding or bruising, seizures, hallucinating, and possible death. And don't forget to talk to your doctor before taking this medication.